Hey guys, sorry for the weird setup. My phone decided that it didn't want to have any more memory before I started this, so we're going to do it on my camera. But I'm going to discuss question 5 on page 106. It says, do you believe that patients are typically aware whether it is the UAP or unlicensed assistive personnel or the licensed RN caring for them? I think this is an interesting question because a lot of times we're too busy to really think about what's going on and pay attention to the small, tiny details of care, such as introducing ourselves in our title. So the blue consider this box on page 99 in our textbook states that many patients who spend most of their hospital visit under the care of an unlicensed assistive personnel, or UAP, believe that they're under the care of RN. One of the things that's drilled into our brains from the get-go of nursing school is delegation. Delegate your most stable patient who needs very simple care tasks like a bed bath or a recheck of vital signs. This is something we have ingrained into our brains. However, most of the time, the patients assume the person taking care of them is an RN. The lay person doesn't know what a nurse aide scope of practice is versus an RN scope of practice. The NCSBN has a good article, and I'll list it below, but it clearly defines the who, the what, when, where, and why of delegation. It's pretty lengthy, so I'll summarize some of the points that I found to be helpful. First of all, the UAP go by several titles depending on the location in the country. It can be nurse aide, tech, nurse extenders, med techs, etc. All these different titles can be very confusing for our patients, especially if they're patients who are coming from out of town who are used to different titles, being a nurse or a med tech. They don't know who we are or what we're doing in our role of practice in their care. So all of them can be very confusing, especially if they're used to a different title. Therefore, explain who you, the nurse, is and who's going to be helping you, or the nurse aide, will help the patient in understanding at least who is in their room and who has what title. Another good suggestion from the article is that every badge should have the title of the person clearly displayed, even if they're unlicensed. I think this is an interesting point because every badge that I've seen so far has who you are on your badge. But I guess there may be some smaller rural hospitals who may not have who they are displayed on their badge. So yes, every badge should have their name and title. I also think that going along the same lines on page 99 of Houston, it says the public is more confused about who's caring for them when they don't see their badge with their title, or if the healthcare personnel doesn't introduce themselves with their name and their title. Now, I know I'm guilty of this because I work in the ER. A lot of times I get very caught up in care of the hecticness, or the patient needs immediate care, and I'll fly into a room and start helping them without even introducing myself, without telling them my name or who I am. This is important because I think we need to get better about communicating to our patients who we are and what our purpose is in caring for them that day. I don't know how many times I've told a patient that I'm not allowed to give them the results of their tests before the doctor comes by and talks to them, and that I'll try to get the doctor in as soon as I can. But I think that the public doesn't always have a good idea on what we as nurses are allowed to do for them, what nurse aides are allowed to do for them, and what doctors can do for them. I think it's a very confusing point to bring up, but I think we definitely need to explain and educate our patients because it may just not be something that they're used to. So in conclusion, I don't believe that the public always knows who a UAP is versus an RN. I think we need to do a better job of educating them at the very beginning of the shift, who is who, and I also think that we need to tell them what our role is in their care. I think we as nurses need to educate a lot more about what we can do for them and what they can ask a nurse aide to do, or what they can ask of a doctor. And I think this will decrease confusion and increase patient satisfaction in their care. Thanks.